Hello everybody, I'm Jed Carney and I would like to acknowledge the traditional owners of the land on which I'm recording this message, the Ngunnawal and Ngambri peoples, and I pay my respect to their elders past and present, and I extend that respect to all First Nations people there with you. Now, I scarcely need to remind this audience that heavy menstrual bleeding is an all too common health condition. It affects 1 in 4 Australian women of reproductive age. More than 60% of these women are iron deficient. It can have really serious effects on a woman's life, socially, emotionally, and physically. It can make it difficult for women and people who menstruate to work, to spend time with their friends and family, or to even leave their home. It can impact their participation in sport, community activities, and their sex life. And yet, less than half of the women with heavy menstrual bleeding seek medical treatment. This is a truly shocking figure. But, while saddening, to be honest, I'm not too surprised. Women's health has for too long been overlooked, ignored, and dismissed. It's part of a wider problem in our society, a gender bias in our health system. Let's face it, a gender bias against women, full stop. I mean, can you imagine if 1 in 4 men had a heavy bleeding condition? It would dominate the news. But until very recently, heavy menstrual bleeding, and indeed women's health, has hardly been mentioned in broader public discourse. And thankfully, attention on women's health and indeed the inequities in women's health outcomes are changing. And that's thanks to you, all of your hard work. I congratulate all of you at the Australian Commission on Safety and Quality in Healthcare for releasing the Women's Health Heavy Menstrual Bleeding Standard and Data Report. This seriously is going to make a huge difference. New resources that will improve the care for women to better manage heavy menstrual bleeding. They'll help clinicians, they'll help healthcare services, and most importantly, of course, they'll help women. The revised clinical care standards outlines best practice care for women with heavy menstrual bleeding. It explains how healthcare practitioners and services can provide better support for women. And importantly, it outlines specific guidance on providing culturally safe care, especially for First Nations women who face, as we know, additional challenges when accessing healthcare. The standard will help women make informed choices about the most appropriate treatment for them, for her individual situation, for her needs, for her preferences. Alongside the new clinical care standard, the Commission's new Women's Health Focus Report has some really interesting observations. It examines variation in hospitalisations for hysterectomy and endometrial ablation right across Australia. There are some encouraging trends. There's a 20% decrease in hysterectomy between 2014 and 15 and 2021 and 22, and a 10% increase in the rate of endometrial ablation between 2013 to 16 and 2019 to 22. Now, we know that hysterectomy is one treatment option, but of course that's a major operation that comes with risks. It's important to note that a range of less invasive and usually very effective treatments are actually available. These include medicines, the hormonal IUD, and procedures like endometrial ablation. The statistics in the report do, however, show considerable variation. While hysterectomy rates are down by a fifth, Australia's rate remains significantly higher than comparable OECD countries like New Zealand and the UK, and they're much higher in regional areas and among First Nations women. So this gives us all, politicians, policymakers and clinicians alike, real insight into where further efforts are needed. Some good work is already being done around the country. An Aboriginal health service in Perth has introduced a gynecology clinic and a holistic model of care, which is helping break down stigma around heavy menstrual bleeding and other gynecological conditions. A Victorian health service is providing education and fast-track appointments for medical management of heavy menstrual bleeding to ensure women can access appropriate alternatives to hysterectomy. But there's much more to do. So by working together, I know we can improve the quality of care and the range of choices available for women everywhere. On a final note, I say to all women, if you are concerned about your menstrual bleeding, talk to a trusted healthcare provider. Explain your symptoms and the impact on your life. Understand that heavy menstrual bleeding can usually be treated by your GP and that hysterectomy is but one option. There are far less invasive alternatives. And look at the resources for consumers provided by the Commission about your options. And I say to clinicians, ask women about their menstrual health. Make them feel comfortable talking about it. Talk to them about treatment options and support them to make informed choices about their care. In doing so, you might be helping your patients to turn their life around. I know I've had very personal experience of this. So thanks again to the Commission for starting many more conversations about heavy menstrual bleeding among women and the health professionals who support them.